Good evening. Thank you for everyone for coming. I'm Dr. Dan Hoft. I'm the director of the Center for Vaccine Development here at St. Louis University. And I'm very pleased to welcome Mayor Lyda Krewson, who has come to tour our facilities and see what we've been up to in terms of the COVID-19 vaccine trials. Just as a brief introduction, I'll say that our Center for Vaccine Development has been here at St. Louis University for about 30 years now. We have a lot of experience of doing preclinical vaccine development work as well as clinical vaccine trials to establish efficacy and safety of vaccines for use in humans. And we are so proud to have the opportunity to do what we can based upon our training to help with mitigating the current COVID-19 pandemic. At this point, I would love to invite Mayor Krewson to come say a few words, and then we'll say more about it.
Thank you, Dr. Hoft. Thank you, Dr. Frey. Really, this was such an exciting tour. It really, really was. So it's great to be with all of you here this evening. First, let me just say a huge thank you to St. Louis University and the entire team here at the Center for Vaccine Development. I really appreciate the opportunity to visit. I've learned a lot tonight. We always knew that you did important work here, but this evening it was great to see the labs, the offices, some of the folks who participate in that work. And it's a chance really to highlight the unique role that St. Louis is playing and our institutions are playing in the fight against COVID-19. St. Louis University has been on the front lines of global pandemics and public health crises for more than 30 years. With deep experience in evaluating new treatments for infectious diseases such as HIV and influenza, in addition to COVID. As home to one of the only vaccine treatment and evaluation units in the entire country, SLU is truly a leader in this field. And now we come together to recognize and highlight SLU's continued dedication to advancing important scientific research. And yet again, part of a historic and global mission that's responding to the urgent need to develop a safe and effective vaccine, this time for COVID-19. The promise and the potential of the work happening in this very building cannot be overstated. And it comes at a time when millions of people, both here at home and abroad, continue to be ravaged by this very deadly pandemic. But there is reason to be hopeful and to feel encouraged. Recently, you know that the Moderna vaccine, the one in phase 3 clinical trials here at SLU, is shown to be more than 94% effective. That is a huge testament to all of the doctors, researchers, and the participants, not just here at SLU, but across the country, all of whom are rising to the occasion and meeting the challenge of this unprecedented moment. They are the ones making the breakthroughs possible. They are the ones putting in the long hours in the name of science. They are the ones helping us all see a glimmer of light at the end of this dark tunnel. I want to thank you so much, Dr. Hoft, Dr. Frey. It's my hope that whenever this vaccine is ready for the world, people will know and appreciate the countless St. Louisans who played a role. So thank you so much. Appreciate the opportunity to be here and see some of the work that you do. And it's so important, of course, for our world, and so proud that St. Louis University and the city of St. Louis has played a role in this. So thank you. Thank you so much.
I would just like to thank Mayor Krewson again for coming and recognizing our activities. We certainly are proud that we have been able to provide some help in the midst of this pandemic. We're also humbled by the ability to be here, to be in the midst of trying to help other people, which drives us stronger than anything else. We're also privileged to have a wonderful group of nurses, laboratory staff, other faculty, others that are critically responsible for all the work that we do. And we can't forget about all of the volunteers that have freely given of their time, take on some risks that we try to minimize every way we can, but there's always some risk in human research. And for people to do this out of the bottom of their heart to try to help, it's just so wonderful that there are so many people in St. Louis that are helping with these efforts. I was asked to give a very brief additional history about our Center for Vaccine Development. As I mentioned before, we have been here for about 30 years. We have a very long history of conducting hundreds of clinical trials, supporting the licensure of over a dozen vaccines, and working on things from tuberculosis improved vaccines, influenza improved vaccines, trying to develop universal vaccines for influenza, flavivirus vaccines like vaccines for dengue, West Nile, and other related pathogens. We have a diverse charge, and we are here to help in situations like this. We have been emergently diverted from the other work that we do many times since 9/11, when we were first diverted from the other work that we had been doing to focus on bioweapons and trying to develop vaccines for them. Since then, we also have been called for urgent work that includes the 2009 H1N1 vaccine development, the clinical trials. We've also been called to develop rapidly clinical trials to look at bird flu vaccines, the H5N1, H7N9, the Zika outbreak, and now COVID. For these last 20 years or so, we have been making ourselves available to help in any way that we can in urgent situations that involve infectious diseases that could potentially be prevented by vaccines. So that's what we do here, among other things. The work currently is more work than we've seen since we've been here. We are trying to live up to the charge, and things are looking so exciting to us. No one in our field thought in their wildest dreams that the first two vaccines tested against COVID-19 would have more than 90% efficacy. And that's what is being seen. And we are just so thrilled that that's the case, because it is the way to potentially end the pandemic and overcome the economic problems that we're suffering, in addition to the other measures we're taking. And I can't stress enough right now that until we can vaccinate everyone and see that the effects on reducing the amount of the pandemic, we all need to follow these public health rules of wearing masks, not congregating in groups, washing our hands, and so on. So I'm going to stop talking and let Dr. Sharon Frey, our clinical director of our Vaccine Center research, talk about the specifics of the vaccine trials that she is leading.
Thank you, Dr. Hoft. I would like to take a second to thank Dr. Lyda, I'm sorry. I would like to take a second to thank Mayor Lyda Krewson for coming to visit us. It's really meaningful to us to have her here and take the tour with us. And after saying that, I would also like to take a moment to reflect. It is, Thanksgiving is upon us. It heralds our holiday season. And we have a lot of things to be thankful for, even though it is COVID season also. So I think what I'd like to do as we give thanks during this season is to thank once again the volunteers who come to participate in these studies. If they did not, our studies would not be possible, and to them we owe a great amount of thanks. I also would like to thank our staff, our nursing staff and affiliated nursing staff, our laboratory workers, and all the people here at SLU, across the university, who have helped us make these vaccine trials successful. We also want to give thanks for the government and the pharmaceutical companies who have brought to bear vaccines that we can test and funded these studies. And so we have a lot to be thankful for, even though we're in the middle of a pandemic. Thank you. So I would like to now move to the studies that we are doing. I would like to say that we have just finished enrolling the Moderna trial, which is the mRNA trial, which we heard about after we heard about Pfizer being hopefully successful with a 95% efficacy. So does Moderna have a 95% efficacy, at least in its preliminary stages of evaluation. We learned today that the AstraZeneca product, which is a very different product, has a 70% efficacy. Again, I'd like to remind everybody that these studies have released results that really are just preliminary results. We need to be patient and see what the final efficacy results will be, but we have a lot to be thankful for, that we will have vaccines available to us very, very soon.